is my live audience for my speech. Okay. Raise your hand if you know someone that's ever been affected by cervical cancer. The number of women dying of cervical cancer each year can be greatly decreased with the mandatory vaccination of HPV. HPV stands for the human papillomavirus. If girls ages through 9 through 26 had to get the vaccine when they were enrolling in school, these numbers would be greatly decreased. I was vaccinated for HPV when I was 16 years old, and I did extensive research over it over the 6 months that it took for me to get the 3 doses that are required. First, I'm going to reveal how cervical cancer is killing women when they're not vaccinated from HPV, then what we can do to lower the toll of women dying from cervical cancer, and lastly, the benefits of mandating the vaccine for girls ranging in ages of 9 through 26. Genital HPV is the most commonly sexually transmitted disease in the U.S. 79 million cases currently affect both males and females in the U.S. HPV is categorized in 2 different groups, one being low risk, which only shows signs of genital warts, and 2 being high risk, showing cancer. Kate Madonna Hines stated in HPV by Peggy J. Parks in 2015 that HPV doesn't go away on its own. It simply infects and lays dormant. The virus never ultimately leaves your body once it's affected. It can take weeks, months, or even years to see symptoms before the virus can be detected. It can be spread during oral sex as well as through skin-to-skin contact without even having sexual intercourse. Now that I've told you about HPV and some of the statistics on its harm, let's discuss ways that we can reduce the toll of women that are dying from cervical cancer. The best thing you can do is get your daughter or son vaccinated. The vaccine was first recommended for adolescent girls in 2016. According to the CDC, in an article by Karina Storrs titled "Cancer Causing HPV Plummeted in Teens Since Vaccine" in February 2016, there was a decrease of infection from 11.5% to 4.3% from 2003 to 2012 in girls ranging of 14 to 19 years old. You also need to get the recommended doses. They recommend that you get the first dose before the age of 15 and the second one 12 months later. If you're over the age of 15 and wait to get the dose, you actually need to get 3 separate ones. One when or after you turn 15, one 1 to 2 months after that, and the last dose within 6 months of getting the first original vaccine. Now that I've told you how to protect your daughter from cervical cancer, let's discuss the benefits of making this a mandatory vaccine. When registering girls for school ages 9 through 26, they need to have the vaccine in order to enroll for school. The National Cancer Institute reports that the widespread HPV vaccine could reduce cervical cancer deaths worldwide by two-thirds of all women in the world. A mandate of the vaccine for girls would ensure better public health. According to an article by Nellie Bristol titled "HPV Vaccine" in May 2007, some state health departments are offering HPV vaccine financing. The state of New Hampshire will actually provide the vaccine at no cost for girls under the age of 18, so it wouldn't cost you anything to get your daughter vaccinated. That's not in every state. It's actually only in 2 right now currently. Now that I've told you why mandatory vaccine is necessary, let me conclude. I've explained how HPV and some statistics on it cause cancer in women. I've given you tips on how you can help lower these case studies and why it's important that we do mandate this vaccine. In the U.S., decisions about mandating vaccines are typically left to the state rather than the federal government. So if and when you're proposed, please vote yes to mandate this vaccine. The only way to fully protect yourself from getting HPV is to to abstain from having sex completely. I'd rather be safe than sorry, and if I had daughters, I would get them vaccinated. I hope you do the same. And this is my live audience still for my speech.